oftentimes I see when people's adrenals are deficient or they've been overtaxed and they're in adrenal fatigue, it often leads to knee pain.
In Chinese medicine, every organ is in control of an emotion, a tissue, a certain area of the body.
Organs, when they are not functioning properly, will lead to pain. Hi, this is Dr. Derek Taylor with the Taylor Method for Pain-Free Living podcast. I'm here with our special guest, Dr. Diana Drake. For our part two here, we were doing a show last week on skin conditions, primarily psoriasis and eczema, and talking about the benefits of using an internal approach. And she mentioned on that something in regards to pain. And so I didn't really veer off of that since we were talking about that subject. But now that we have her set aside for just this topic, would love to hear your insights on your thoughts on dealing with painful conditions and what you do from a naturopathic approach. So can you tell us a little bit more about how you got into helping people with pain that they've been dealing with?
Yes, absolutely. Full disclosure, this was just something that I kind of put together for us for this podcast. Pain would typically not be something that people come to me for very often. It tends to be one of their symptoms, though. When I do the full intake, they'll mention, "Oh, I have pain here and here and here." Whenever someone mentions pain to me, I send them to a chiropractor. That's my number one thing. And a lot of people don't realize that chiropractic isn't just in the pain bucket. So if our spine isn't properly aligned, it's literally cutting off the healing energy that's going to all of our different organs. So, number one thing on my list today was chiropractor.
Right.
um, and then I just kind of made a list of some other things that can cause pain in the body as well, besides the spinal piece. But a lot of these things could be going on multifaceted. The second thing I put is lack of oxygen. So, oxygen is the most abundant antioxidant. We're breathing it in. And if we are not oxygenating our tissues properly, this can absolutely cause pain. The remedy for this is a PEMF mat. Dr. Taylor has a very strong, kind of like commercial grade PEMF device in his office. I have one that I use at home. It's called a QRS. You guys may have heard of a Beamer, but things like this are going to help the cells to detox and oxygenate. And when we're doing that, we're going to really help significantly with pain. Depending on the kind of mat you have and what kind of training you have access to, different settings or frequencies will access different things in the body. So, for example, my mat on level 2, that's really going to hit the fascia and the muscle tissue, which is really important for me because I have so much structural pain, just especially down my spine and back and neck. So, that's something that I sit on every day. I also take a nitric oxide supplement, which I highly recommend. You can also take an oxygen supplement if you can find one. Um, and then, do you have questions or comments on that, Dr. Taylor?
Yeah, no, that's great. I love the fact that the PEMF, just charges all those cells, and when your cells are functioning at a low energy, you're going to have pain. You're a lot
Exactly.
more prone to pain. You start to get those functioning at a higher level, then the pain dissipates. But oxygenation, yeah, you have hypoxia.
Mhm.
That's just ischemia. It's going to be death to the tissues. So that's why exercise, I think, is important. Oxygenating the tissues that way, deep breathing, getting
Mhm.
out and getting some fresh air. All these things are beneficial for regular lifestyle habits to
Absolutely.
decrease your, you know, levels of pain or decrease your risk of being in a painful condition. So no, that's good. Keep going.
Yeah. The next thing I had is dehydration, very important. Um, we talked a little about this the last episode, but everyone, if you're drinking caffeine on a daily basis, you are just dehydrating yourself. And it's sad that caffeine is a drug. Just because it's accepted by society and like pushed in our faces and on every corner with Starbucks, it does not mean it's healthy for us. And people are so scared when I take this out. This is usually the first thing that I take out when I'm dealing with anything. Um, and people really are scared of doing this, but you wean off slowly. You don't stop cold turkey. Excuse me. Sometimes I'll give a little bit of ATP supplementation that'll just give you a little bit of energy. It's a non-stimulant energy. But if you wean off and then give your adrenals a couple weeks to bounce back, depending on the condition of your adrenals, but usually your normal energy will come back and you're just like, I don't need coffee. But it really is dehydrating on all of our tissues and just not great. It's the insecticide of a plant. Do we really need to be drinking that? I think not. As far as water, adding minerals back, I add Celtic sea salt back. That just helps make sure that the water absorbs, which is really important. But yeah, dehydration. So half your body's weight in water in ounces. That's probably the only FDA recommendation I will ever think is agreeable, by the way. And after that, I had lymphatic congestion. So just the things Dr. Taylor was just saying, getting out fresh air, exercise, that's really great. But also doing an herbal detox, I think is really great to just clean out your blood and your lymph and just toxins in the body. So we don't have inflammatory things building up. Do you want questions, comments, concerns, Doctor?
Yeah, no, I think, it's hard for, you said it's scary for your clients to get off of coffee, and it's addictive, people forget that
Literally.
caffeine's and it's addictive. It's, it's like a drug, like you said. And so they're addicted to it. And they don't even know it.
I don't even know
They
it.
feel like they can't live without their coffee.
I know.
It's like become a crutch for them.
Hmm.
And it's taxing on the adrenals. The adrenals or as you know, our stress glands. And so oftentimes I see when people's adrenals are deficient or they've been overtaxed and they're in adrenal fatigue, it often leads to knee pain. So and they'll have pain and problems going upstairs and whatnot just because their adrenals are so wiped out. But organs, when they are not functioning properly, will lead to pain. The different organs that refer to different parts of the body, when the liver or gallbladder is toxic or stressed, they'll have pain in the right shoulder blade area or the right shoulder. If they have issues with their stomach, they'll have pain right here in the neck. Of course, if somebody has stress on the heart, the classic symptoms of a heart attack is pain down the arm and to the jaw and to the upper back. So a lot of times people come in with left shoulder and left arm and cervical thoracic pain, and it's really stress on the heart.
Yeah.
And that can be stress from toxins. It could be stress from vaccines. It could be stress from, mentally, they're grieving, or there's a death in the family and they don't realize this. But yeah, you mentioned the organs, and this is what you do so well as a naturopath, is strengthening all those organs and helping them to detox. I'm sure you've seen by doing that, people's pain levels have decreased. Have you seen that in your practice?
So full disclosure, I just make them go to the chiropractor and it helps.
Yeah, but when you're working with organs and you're seeing organs improve through the supplements that you
But
give.
yes, overall, people feel much better. And you're
Yeah,
right. So in Chinese medicine, every organ is in control of an emotion, a tissue, a certain area of the body. So you're right. If you are, if the same meridian running through a certain muscle is, to that organ is off, it's going to cause a problem in that whole system that meridian is touching.
right. That's why when women are in their menstrual cycle and they get bad cramps, it'll cause back pain, right? Lower
Yeah.
abdomen pain. I mean, we all know these things. A lot of times we just don't associate those things with that.
Yes, and fun fact, did you know that it's not normal for us to have bad cramps on our period?
Yeah, no, that's a sign of there's a sign of dysfunction there, an imbalance.
Yes, yeah, and most women, we don't know this, and we just, when we're young, we have acne, we have bad periods, we go to the doctor, we get put on birth control and sent out the office, but really there's likely PCOS. If you have cramps to the point where you are uncomfortable, nauseous, or have to feel like you have to take medicine, that is wrong.
Yeah.
We
You
should
mentioned that
not
on
have
the
that.
last show, PCOS. Seems like you got a little passionate about that when you're talking about it in the
We
last
could
show.
do a whole show on PCOS.
So how can you talk about PCOS and pain? What are some of the most
Yeah.
overlooked and most misdiagnosed? Say somebody does go to the chiropractor and
Mhm.
they misdiagnose it as something like a subluxation when in reality it's PCOS. Can you talk about some of the relations between pain and PCOS?
Yeah, that's a really good point. I'm sure you can get some relief, right? Taking some pressure off the spine in that area, but really the excess androgen problem has to be addressed. So if your periods are painful to the point where it's that uncomfortable for you, we need heavy detoxing, and we just have to address those excess androgens. So
How
I
do you
also
do
have
that?
PCOS. So I put people on a detox, and then I also have a suite of products for PCOS that I've created. So that would include myo-inositol, which is a sugar alcohol that is very anti-inflammatory, and it helps manage ovarian health and excess androgens. It's like the number one supplement women with PCOS are supposed to be on. It's also good for insulin resistance. Um, then I have this blend, and it's called Andro Assist, and it's just herbs that help lower androgens. So there's like spearmint in there, licorice, reishi mushroom, white peony. So it's just a nice blend that kind of helps push those androgens down. And acetylcysteine is very important for women with PCOS. And acetylcysteine is also a great supplement for pain as well. I have a whole list of supplements for pain that I made for us.
Yeah, let's hear about it.
Um, okay, wait, let me finish the PCOS because then I'll
Okay.
get to my brain. And then I also like to put them on berberine for the insulin resistance. So periods are going to be way better. Acne is going to go away. I also have a really beautiful product called Lighter Cycles. That's just anti-hemorrhagenic herbs. So women that are having very painful and heavy periods, it's not so burdening on the body during the menstrual cycle. But just for example, I used to have the most horrible periods. I didn't know I had PCOS. I was on birth control, yada, yada, yada. I discovered this later a few years ago on myself. I don't even feel my periods coming anymore. And when I barely know that I'm on it. When I'm on it, I don't have the pain anymore. I don't feel sick. I don't have the swelling. It's just a whole different ballgame.
Does that change the length of the period as well, the menstrual cycle? Does it shorten it or?
It shouldn't, but again, if you are, so two sides on the PCOS, your periods are either really nasty and horrible and heavy, or you're not having them enough. So if you're on the not enough side, we want to bring that into regulation and shorten them, right? So that they're normal, but it shouldn't affect a normal cycle is still 5 days with every moon cycle.
Okay. But it's just a lot easier. There's less
So
pain.
much easier.
Does
It's
it
not
affect the
supposed
flow
to
of
be,
the cycle? Is it less heavy as far as the cycles? Normalize it more that way?
it can, if we get on the lighter cycles, yes.
Mhm.
Yes, it's just a lot nicer of a situation.
Right. Good.
It's just a lot more gentle.
Well, I think there's a lot of women struggling with that. In fact, when they have painful periods, they go to the medical doctor, and that's what they do. They put them on birth control.
I know. And
Crazy.
my rule is birth control is for one thing only. Can you guess what that is? To control getting pregnant. If
Right.
your doctor puts you on birth control for anything
Anything
else,
else, look out.
no, that's not right. We need an actual diagnosis of what's going on. We need to I check with saliva and urine for hormones. I don't do blood. It's just we're not getting bioavailability when we're doing blood. So I do in-depth hormone testing and really find out what's going on. Most doctors don't even test for excess androgens. They just think it's regular testosterone. They don't even know the difference.
Mhm. And how much does that testing cost to do that? You're testing with, if somebody is dealing with listening here that's got PCOS, and how much are
Sure.
the labs typically when you use saliva?
If you just want to know if you have PCOS, yes or no, it's $199 saliva test. If you want the full robust hormone test where I also get adrenal function all day, so it's a five tube saliva, that one's $275. And then we do a urine, which I believe is around 300. So it's still, I think it's very reasonable, but you get so much robust data.
Yeah. The urine test is an additional 300, or does 25 to make it?
Oh, correct, but we only need one or the other. So some people have a hard time spitting, or they don't want to do the 5 different times. So I'll let them do the urine test just because it's easier to collect. But the most robust and most accurate data you will get with hormones is going to be with saliva, period.
And which lab company do you use? Biometrics?
That one goes through Access Medical Labs. They're actually in Jupiter.
Oh, they're in Jupiter.
Yeah.
Great.
Mhm.
And so let's talk now about the supplements that you
Okay, sure.
recommend for.
Yes. So you guys, a lot of pain is going to be like the joints, the knees, the hips, kind of, when we start to get into arthritis and things like that, obviously spinal pain as well. But some great supplementation. Okay, this one's an easy one, but just in case, I have to mention the MSM and glucosamine. That's going to help with lubricating the joints, right? So that's very important. But some other things you might not have thought of, CoQ10. This is a great antioxidant. This is really, really good for pain, especially when you're doing the MSM and the glucosamine. I like to throw in, again, the N-acetylcysteine. And also, if you can find some sort of an anti-inflammatory blend, maybe it has curcumin or turmeric or something of that nature, but something anti-inflammatory, pain, something along those lines. I think the mistake that people make when they're supplementing for pain is they'll say, oh yeah, I tried the glucosamine one time, it didn't work for me. First of all, you're not going to fix anything ever with one supplement. That's my rule. You need a protocol. Okay. So we need to make sure we have a few things that we're, addressing the symptoms with. And I also want to just always tell people to make sure you get supplements that do not contain magnesium stearate, which is a binder, and it also might be in the capsule and it's toxic, even if it's vegetable sourced. You want the cleanest capsule you can possibly find. You want it to say veggie capsule, gelatin capsule, kosher capsule, rice capsule. You don't want things you can't pronounce in your product or your capsules. So just be cognizant of that. There are a lot of brands that have amazing products, but then their capsule is crap, to be fully transparent. So just kind of watch with that. Pure Encapsulations is good. They have clean capsules. There are a lot of brands that have very clean capsules, but there are a lot that don't. So just aware of that one.
Right.
Also, another one that could be really good is hyaluronic acid internally. And that also can help with good bowel movements as well.
Yeah, great.
Mm-hmm.
Okay, well, thank you so much for your insights here with pain and PCOS. And I think PCOS is more common than people realize. They don't give
Absolutely.
a lot of credit to that.
Mm-hmm.
Yeah, I think you need to address those underlying issues there with that. How often do you see PCOS in your practice?
95% of women that come to me with a hormonal imbalance have PCOS.
Wow. And how
Unless
long
it's someone with menopause that are coming to me for that, right? Separate, but most young women have it.
what's the average age that you see in your practice from when people reach menopause and they stop having their cycle? And
I would say like early 50s. Some people are getting a little early, but a lot of people come to me because they maybe had breast cancer, or they've just been told by their doctor, you can't get on HRT, or maybe they've already been on HRT for 15 years. And apparently it has a limit, like you're only supposed to be on it for 15 years. But then if you put they're putting people on it younger and younger. So if you put a 28-year-old on HRT and it has a 15-year shelf life for how long they're supposed to do it, then what do they do in 15 years?
well, they're putting my patients, they're putting there on their teens. They're putting
insane.
high school gals
I know.
on birth control for their periods.
I know.
Anyway,
Yeah.
instead, call Dr. Drake.
That's a whole show. That's a whole show.
Call Dr. Drake instead.
Right.
Well, thank you so much for your expertise and your time. We kept you on for a little extra longer. It's been a great show, and thank you for your wealth of knowledge and information. And how can our patients and listeners and audience get a hold of you once again for this show?
Sure. So it's DMD Natural Medicine. That's my practitioner site. And I do offer a 15-minute phone consultation just to make sure your case is a match for what I do. And as far as I think that would be a good place to start. Yeah, start there.
Okay.
D Natural Medicine for that.
All
Yeah.
right, great.
Need help with hormones, thyroid, anything of that nature.
All right. Well, you've been with Dr. Diana Drake, Doctor of Naturopathy, and board certified in this. And thank you so much for your time. This is Dr. Derek Taylor with the Taylor Method for Pain-Free Living podcast, signing off.
You've been listening to the Taylor Method for Pain-Free Living podcast. We hope that you found great value in this episode. For more information about the Taylor Method and our offices, visit www.drderektaylor.com. Make sure to tune in next week, as Dr. Taylor will be providing more knowledge and resources about pain-free living.